Hello, I'm Taz, and I'm an emergency physician, and I've been practicing for 22 years. I've never made a YouTube video. However, in the last week, I've been compelled to make this video in response to two congressmen, Mark Meadows of the congressman from North Carolina, and Ron DeSantis, the congressman from Florida. And specifically, Mark Meadows stated that individuals can be seen at an ER. They're required to be seen by law and receive medical coverage. That was a completely inaccurate statement. And Ron DeSantis yesterday stated that a cancer patient can be seen in the ER and be treated for their cancer, and that all that means is that the care is transferred to some other doctor, as if it's irrelevant who's taking care of the cancer patient. That also was inaccurate. Congressman Meadows is referring to the EMTALA, Emergency Medical Treatment and Labor Act, when he specifically stated that people can receive medical coverage in the ER. You can't receive medical coverage. We don't provide insurance, and there is no medical coverage. Okay, it's completely wrong. What we have to do by law is perform what is called a medical screening exam, which means if you present to an ER, you must be seen by a physician and determined to be stable before we can allow you to leave or be transferred to another hospital. That is not insurance. That was done to protect patients who don't have insurance from being turned away from ERs. That's what that represents. That is not to take the place of primary care or preventative care that people are seen for by their primary physicians. So he was misleading, and he didn't know what he was talking about. Ron DeSantis also didn't know what he was talking about when he was speaking about the cancer patient being able to come to the ER, because we don't provide chemotherapy. We don't provide radiation treatment. Nobody does surgery on cancer patients to remove a cancer. Those patients are taken care of by cancer specialists called oncologists. We don't have oncologists sitting in the ER waiting for patients to come into the ER to be seen. So I'm not sure who he was referring to who's supposed to be taking care of these patients who have to receive care for their cancer, because he was speaking out of ignorance. What annoys me the most is that there are, in fact, physicians who are in Congress, and these two individuals had an opportunity to go speak to these doctors and get more informed before they spouted what they did on national news. It was offensive the statements that they made, and it minimizes who we are as medical professionals and everyone who works in it, the physicians, nurses, emergency medical technicians or EMTs, emergency department technicians, medical clerks, any of the medical staff that are involved in the emergency department. They were offensive in what they were describing. We are overwhelmed in the emergency departments as it is. Way more patients than there are medical staff to take care of them. And on top of that, there's a national shortage of physicians and nurses, emergency physicians and nurses. There's just a national shortage of physicians and nurses in general, and including emergency department nurses and physicians. So when these two individuals are stating cavalierly that anyone can go be seen in the ER, it's as if they're assuming that when you come, you're going to be seen quickly, you're going to be taken care of and sent on your way. Now, it's easy for them to be cavalier because their insurance is paid for by our taxes. They most likely don't have to wait because they are who they are, so they're flippant. They don't care. It's irrelevant to them. They make a statement, they go on home to their wife and their kids, and they live their life, and they don't care what impression they left everybody with. And patients who believed what they said think they can go get seen or come get seen at an ER and be managed appropriately. It won't be appropriate management because we're limited in our resources. We are focused on acute care only. We do not do primary care as a routine. Um, I wish when they're on these shows that the anchor people would have enough sense at least to have a medical professional on their show as well to counteract this type of ignorance, to be able to clarify to the public what is accurate. But they don't. They let these individuals speak, and then it's just left hanging in the air, their impression. I think most Americans have common sense and they understand that that's not the purpose of an emergency department. And you have these two well educated men who are in Congress who are an embarrassment. They're an example of how one can be educated and still remain ignorant, and they didn't even bother to go get informed, even though they have the ability to do so. They didn't. They just spouted information that when they had no idea what they were talking about. So I'm here to clarify that. And I'm here to say that we do care about patients. We wish we could take care of everybody, but that's definitely not possible. That's why other physicians exist. That's why you have primary care physicians to take care of the masses who need routine medical care. We're there for life-threatening emergencies, anything that's life, limb, or eyesight, or surgical emergencies. And thank God that people have that option. But it is not to be used as a clinic. It's an inappropriate use of the emergency department and our resources. We need to be there for true emergencies so that we can save as many lives as possible and intervene where is necessary as quickly as possible. So please understand that that's our purpose and that it shouldn't be as casual as they made it, and that we hope that in general, everybody in this country will have access to medical care that is appropriate. And I wish us all the best. God bless us. Thanks.